You are welcome again to our regular Health Talk series on Ignite TV, where we discuss series of health issues, most especially the common ones that people doesn't take cognizance of that later cause future complications. Health is a state of complete physical, mental and social well-being, and that is why we have to touch those cases that have something to do with or emphasize everything. This morning we'll be discussing the topic depression. What is depression? It's a common and serious medical illness that negatively affects how we feel and the way we think and how we act. What are the causes of depression? Under the causes, we have a lot of causes. Number one, we have the biochemistry one. Under the biochemistry, we have cases where people are put under stress. Stress is a normal phenomenon, but the way people react to it are different. Take for example, loss of loved ones, in cases of divorce, sudden divorce, or whatever, the way people react to it, some people might go into case of depression. We have genetic. Genetic has something to do with the biological family traits, and that is why we see in some people they say before they get married to a wife or husband, they want to know the family history. Is there any cases of mental illness within the family? And that is why we are relating it to the genetic factor. If you have a twin with mental disorder, the tendency for the second twin, 70% tendency for the other one to have a case of depression. We have personality. We have different type of personality. My personality might be different from yours. I may be an introvert. You might be an extrovert. The way we react, the way we take something, and the way we keep things to ourselves differ. People with low esteem are different from people with high esteem, and that is where personality comes as one of the causes of the depression. The environmental factor. The environmental factor comes in exposure to violence. Some children are exposed to violence, sexual abuse, child abuse and serious, and this may contribute to adolescent depression. We have other causes like neglect, child abuse and poverty. They are all related to depression. Loneliness is another factor. When we have cases of a wife losing the husband, being lonely, we have parents being left or neglected by their children. Loneliness in general can cause depression. We have the factor of alcoholism and drugs. There are several drugs people take that lead them into depression. Some are taken as a result of treating some other medical condition that later lead to another problem. Some are taken as abuse in form of marijuana, in form of Indian hemp, in form of cocaine or what have you, taken that may cause another brain problem. We have illnesses. A prolonged cases of illness that doesn't respond to management and treatment can also cause depression. The ill person, the sick person will be fed up and will start having one thinking or the other, ruminating over issues when the cases are not responding to treatment. We have giving birth, and this is where we have post delivery depression. It is also as a result of release of some hormones during pregnancy and postpartum. We have stressful events When some people are exposed to stress, they may not be able to cope. We have other factors. We have a lot of factors. With all these factors, the major of this presentation is not to know just what depression is not to know what and what can cause depression, but we really want to know how do we assess ourselves to know whether depression is in situ or not. Some people have depression but they cannot discover, but as a result of this program you be able to give a self-assessment. What are your self-assessment? Number one, you have to check yourself. Have I been having a feeling of being sad or being aggressive or anger over nothing? Being sad or being aggressive or being angry over something that doesn't worth it for some weeks or months. If this occur, is a yardstick. We need to assess ourselves to say, if this is occurring to me, then I have to see a physician before you get to the other side of the problem. Number two, losing interest in the environment. Somebody that has been an extrovert, go to party, meet with people, embrace situation within their environment, behavior and what have you. All of a sudden you observe that you become a withdrawn person, no more interested in the activities of the environment, don't at ten d to people, don't relate with people. There is a case of withdrawing or keeping yourself isolated from people. They are all self assessment. If all this is occurring, one might be thinking, I need to see a physician. Self assessment can help to prevent the problem from aggravating or getting to the next level of the problem. What are the signs and symptoms? What are the signs and symptoms? What are the signs I'm going to see? What are the signs you are going to see? You may be an observer to see the signs and symptoms from a friend, a neighbor, a church member, or a relative. When those things started occurring, the person might not even be able to identify that, look, it seems this thing we are discussing is really talking about me. But the people around will help to identify all those things. Or the person might be relating or discussing or complaining to the next person. So what are the signs and symptoms? In some of them we have persistent body ache. Persistent body ache. Initially, and this is malaria. Probably it might be typhoid. In some cases, it might be a sign of another thing. Some of them have withdrawal. They don't relate with people again. They don't want to relate. They don't want to do anything with anybody. They want to do themselves. They want to keep themselves. They don't want to be disturbed by people around. There is feelings of being sad. They are always very sad. Every little thing they are sad about it. There is loss of interest for pleasure. Those activities they've been involving themselves. As a choir is no more interested in being a choir. As a person in the family that used to organize things is no more interested in organizing the thing. There is withdrawal at general level. There are changes in the appetite. Most of them will have loss of appetite, and whenever there is loss of appetite, what usually follow is loss of weight. It comes, in some cases we have malnutrition. It comes after each other. Though we see cases and research has proved that some of them, instead of having loss of appetite, have ferocious appetite. That is, they will be eating excessively. But that is very, very rare, but it does occur. We have trouble in sleeping pattern. Even if they work from morning till night, they find it difficult to sleep. They find it difficult to sleep. There is trouble in sleeping. There is loss of energy. or there is increase in fatigue. Any little thing they do, they feel tired, they feel as if they don't have energy to continue. There is feelings of worthlessness, that what is the worth of being alive? What is it that I actually want? There is feelings of worthlessness. Difficulty in thinking. They find it difficult to think for themselves. It is until when they say, "Ah, maybe we should do it this way," or "this way my brain is faithful to you." It is then and then they start thinking at that end that okay, they should be able to do it. Aside that, there is lot of concentration. There is difficulty in concentrating. If you involve them in anything that needed their concentration for a long time, at a point they might not be able to continue. There is loss of concentration. Loss of making decision, whether in crisis or in good situation. They find it difficult to take decision. Decision making becomes difficult. They need people help, they need people, and in most cases some of them are not even have a good decision maker, so they find it difficult to make their own personal life decision. As signs and symptoms, most of them have loss of libido. If it is a woman, there is rigidity, doesn't want to have anything to do with the husband. Even if there is anything like love affairs, they find it difficult to enjoy or to partake or to contribute during the course of sexual intercourse. And if it's a man, there may be loss of erection, that might not be able to give a good sexual performance. Some of them, as bad as it is, do have cases of crawling movement within their body. You will see them, it seems there's something crawling all over my body. Something is crawling as if a lizard is moving all over the body, crawling sensation. Some of them severe itching sensation, most especially when the level of depression is getting higher. They will be having a lot of biting sensation, eating sensation, crawling sensation over the body. Is as bad as there is thought of death or suicidal attempt. And that is the major thing why we are having this program. I want to beg of us, suicidal attempt or thought of death is not the solution to depression. There is no doubt about it, depression is real. And that is why we have to lis ten to this type of program. We have to take our self-assessment. We have to allow ourselves to be seen by a physician whenever the self-assessment is positive, and make sure all that needed to be done are done before it gets to the level of jumping into the river, committing suicide by roping, drinking of poison, or what have you, that may be suicidal attempt or even death. Before you get to this, I want to tell us as parents, we have the young generation, a child of 18, a child of 20, a child of early age going into depression. Before it get to this stage, there are a lot of things as parents you might have observed in those children before it gotten to the level of suicidal attempt. What are the things? A child that has been a lovely child, we relate together, we joke together, we chat together in the sitting room, we start leaving him in the sitting room and keeping to herself or himself in the bedroom. She doesn't want to relate, she wants to keep to herself, she doesn't want to express her mind. She feels as if with isolation she can solve some of these problems. If as parents we observe this, we need to bring back the child to herself, be more friendly, and grow into their problems. Some of them are being debt, Some of them might have involved in some cultism or into some society unknown to the family in which they've gotten to and they cannot express or live on their own. Some of them might have been involved in taking drugs or what have you. But by the time you keep the child to yourself, embrace them, discuss with them, you will be able to identify that there is a particular problem and solve it together with this child before it's gotten to the level of suicidal attempt or even death. How do we manage depression in the homes? Once it is identified there is a case of depression, the best advice is to see the physician, the psychologist, the medical person, the specialist that take care of these cases. There are a lot of things one can do depending on the stage of the depression. The whole management is identification of the problem, curating a period of embracement and love, identification of the cause of the problem. The next stage is getting to the hospital for remedy of medication, which might involve medication of drugs, psychotherapy, and every other thing that should be given. So, with this, we should be able to identify, and once it is identified, we go to the hospital. I pray we will not have any of this problem. And if there is, peradventure, if there is, I encourage us to go to the nearest hospital for medical attention. Thank you very much. See you next week Saturday.
Ignite TV, igniting the good news on your screen. Ignite TV, ignite.
To our second segment of the discussion. Don't forget, we are discussing depression. To every home, to every church of God, to everybody, we need to be aware that depression is real. Depression is real. It's as real as people go into depression without realizing they have depression. And that is the essence of this program, to enlighten us, to identify the problem, to broaden our information, and to keep us enlightened about the critical condition depression. At this segment, I want to treat those factors that can help us in order not to go into depression. What are the factors? Number one factor, minimizing of excessive life and not involving ourselves in a fake life. Some people go to depression because of debt, buying gold, buying this, buying those things you cannot afford. At the end of the day, when the people started running after you, some people go into online borrowing, taking loans online, even without having something to pay for. All this, when there is accumulation and the debtors started running after them, it become a problem. They will not be able to sleep. They will be running from pillar to pole at a point, and nobody to discuss it. They may get into the problem. Number two, the number two advice is never you go into taking of any drug without prescription. We have some drugs that naturally we use it to treat medical condition like thyroid disorder, some hypertensive disorder. Those drugs used are under prescription, and the medical person or the medical practitioner that order the drug will be monitoring the patient. That is if the patient is taking the drug under prescription. Paraventure, if there is going to be any problem, it will be early identified. Early identification is either they stop it, they reduce the dosage, or what have you to solve the problem. But if the patient has taken a self medication on herself or himself, even if there is going to be problem, nobody is there to oversee. That is number two. There shouldn't be any case of self medication nor drug abuse. The drug abuse in most cases might not be necessarily taking marijuana, cocaine, or what have you. The normal drug too can be abused, like tramadol, taking so many number of drugs to achieve the regular action the drugs may have been taken. All this we should endeavour to avoid, so that we won't put ourselves into unnecessary problem. Early assessment, that is self-assessment, and prompt going to the hospital to see the physician, so that at the early part of this condition it will be identified and there will be medical so psychological management before it got into the level of suicidal attempt or whatever. More so, another thing is that we want to be our brother's keeper, our sister's keeper, and everybody's keeper. We've seen cases where the person involved in depression might not even identify. It might be a church member, the people in the neighborhood, a sister, a family, that will identify this problem and call the attention of the person involved. Once the person is involved, the person is informed, the person will be able to see the medical practitioner before it gets out of hand. As part of the advice on this program, I want to say that once a person has gotten to the hospital, there shouldn't be any combination therapy. Giving an herbal drugs with the medical medication might not help the situation. And in some cases, you might be hearing people say, it's a spiritual attack. This is not ordinary. Don't take her to the hospital, or don't take him to the hospital. Usually, depression is a medical condition, and it will be adequately managed by drug, by some other machine, and psychotherapy, and the patient will completely get out of the condition without further complication coming out. On the other side, I want to put it to us that whatever the case might be, if we identify anybody within the household, we should not wait, because waiting and delay might be dangerous. Okay, it is identified this Sunday, and next Sunday we will do something about it. You might not be too sure before the next Sunday the patient might have taken his or her own life. suicidal attempts or even death that have taken place. So at the point of identification of depression, the same point, at that same point, an action, a concrete action must be taken to prevent unnecessary situation that one might not pray for. On this note, I want to say thank you for being, for your attention and for your time taken to listen to this wonderful topic. I encourage each and every one of us to take good care of ourselves, both physical, mental, social, and every other part of our health are all important. We'll be seen and we'll be doing next week Saturday by the grace of God on the same TV line with Ignite. Thank you very much for listening.